sciences. For the last 20 years, what that's meant is I've been at NC State for 11 years, but for the last 20 years in the world of food safety, I really focused on pathogens that make people sick through food, things like salmonella, pathogenic E. coli, norovirus. Over the last 12 weeks, 13 weeks, it's kind of pivoted a little bit because I've spent a lot of time looking at COVID-19 response and COVID-19 in food settings. I'll talk through a little bit of this today, but really want to spend time answering as many of your questions as possible. So as Andy mentioned, we had some questions come in over the last couple of weeks. And they're very, I guess, generic and similar questions that we're hearing from lots of different sectors. So I want to address some of those quickly and then open it up for Q&A to make sure that I can answer any other questions that are out there. To give you a sense of what I've been doing over the last 12 weeks or so, I've led a group of folks like me, other food safety specialists across the country, on developing best practice guidance for food settings around SARS-CoV-2, which is the virus that causes COVID-19. And for, as I mentioned before, for various food settings, from harvesting in strawberry fields all the way through to consumer homes. The reason why we kind of moved into this space is because early on at the start of this pandemic, there was very little information from CDC or from FDA specific to foods. And other than saying food is not a vehicle for the virus to move in any sort of risk sort of way. And I'll get into that in a minute. But what we really were being asked from the food industry, whether that was restaurants or grocery stores very early on, or as we moved into meat and poultry plants and harvesting for vegetable production, fruit production, was what do I do? How do I manage this? How do I make sure that my employees are safe? How do I make sure that my management is safe? And how do I ensure that we are doing everything we can as people come here, that we're making sure that they are not transmitting the virus? And what do we do? How do we answer questions about food when people are asking them? And so in response to that, and what I think really connected, Andy and I have known each other for quite some time, but what connected us on this issue was a program that we were the technical foundation for, that probably was talked a little bit about yesterday, with the Count on Me NC program for restaurants as well as general businesses. So I'll talk a little bit about that as we go along. But that's the area that my group is really focused on for the last little while. So I guess general questions that we've had about reopening. So let me handle this in sort of a quick way. One of the things that I think is important for reopening is really connecting with experts on this. And in many cases, for folks that are on this on the webinar today, if you're in the state of North Carolina, I think it's an easy answer. For me, it's working with cooperative extension in your county. We've done a lot of work on training extension individuals, agents in lots of different areas to help with this, but connecting with trade groups and any public health educators out there, and having a real big, I guess, plan is really the key. I'm being around the world of executive orders for the last 12 weeks or so, especially as it relates to restaurants and grocery stores. I think that we're often not getting a very specific set of recommendations about exactly how to manage an agritourism business. I don't think you're going to see that explicitly, but I think you're going to see food settings and what to do in sort of general public areas, and so looking for that information now. And really, regionally, I think it's important to look at sort of task forces, being able to have a group of agritourism businesses that are all in the same area, working with the local health department about what their expectations are. One of the things that we've heard really, I guess, extensively from the food industry nationally is that instead of what we're normally dealing with, which is 50 different states with slightly nuanced rules and different ways to look at food safety, we're now looking at 3,000 different health departments across the U.S. that also are nuanced in the ways that they're approaching COVID-19 because community spread is very localized. It's a little bit different from what we would see from E. coli and Salmonella, which how that acts here in North Carolina is really the same way that it acts in Iowa. Here, the large amount of community spread is really going to dictate what the best course of action is. So my first sort of message, the question is, how do I plan best for reopening? My first message is really work with your local extension folks, as well as calling your local health department to get their take on what their expectations are. So what does that mean for you? And so a question came in about, well, what are the priorities? What are the things that I should be doing in an agritourism setting? And here, I guess, big topic areas to consider. Managing waiting and congregating areas. We know, if I step back a little bit, we know that the biggest risk associated with this virus, the number one thing that we know leads to transmission is person to person, being around other people. We see the role of high touch surfaces as a factor, but not at the top of our list. It's really being around others. So managing waiting and congregating areas. If I think about a farm market, if I think about a farm tour, if I think about an event that's going to happen in any sort of agritourism setting, having a way to manage those areas and really explaining and communicating to your patrons and your customers what it is that you want them to do, keeping in mind that the biggest factor is really being away from other people. So providing ample space, providing a way to have physical distancing and social distancing, whether that means in an area where people may have eaten food outside in the past, spreading those tables out so they're much further from each other to allow for physical distancing, and really managing that process. Standard operating procedures is the next thing on my list. Just really coming up with a plan. What is it that I want my staff to do? What is it that I want my patrons to do? What are the things just really spelled out? How we're going to handle hand sanitizing and hand washing? How we're going to handle serving individuals? Is that different than it was in the past? And likely it very much is, because I've got to keep in mind how I'm going to manage social and physical distancing. The third thing on the list here is employee health. I look at this in two ways. You really, for your staff, want to make sure that you're providing the safest place for them to work. That means screening employees for COVID-19 illnesses and symptoms and illness. Having a way to manage temperatures and really telling them, here are the things that you need to be on the lookout for. Elevated temperatures, being around other people, respiratory distress, coughing. These are all common symptoms that would show that the person is at elevated risk for carrying the virus. But having a process to do so, having a set of guidance for those employees to say, here are the things that I need you to do, and then knowing what to do when someone says, I don't have any symptoms, but I have been exposed to to someone who is symptomatic, what do I need to do as an employee? So I'll talk a little bit about the Count on Me NC program in a second, but we go through specifics, and CDC and our state health department really have guidance on exactly what to do in those situations, and how those employees should seek out tests to know whether they are positive for COVID-19, and steps on returning to work and the time frame for that. And there's no sort of magic bullet on that. It's a combination of testing and no symptoms, but it could be anywhere from 3 days to 14 days, depending on the situation that those employees are in. And then the last one is looking at cleaning, sanitizing, and disinfecting of high-touch surfaces. And in an agritourism setting, there could be lots of high-touch surfaces. There also could be very few. It really depends on your individual business and your individual setup. And so really, as an operator, thinking through what an employee might touch and what a patron may touch, and focusing on those surfaces with a cleaning and disinfection process. So moving forward, I mentioned this a little bit, COVID-19 and food safety as a topic area. COVID-19 really isn't a food safety issue. We don't have any examples. We don't have any clusters of illnesses. We don't have any situations where individuals have eaten a specific food and then gotten sick with this particular virus. But food environments can be a concern because of congregating, because of high touch surfaces. So there's a lot of biological reasons why we don't see food being an issue, but I could see, and I know we got a question about this, and I'll address this now. We got a question about events, weddings, parties in agritourism settings. I don't worry about the food itself, but I do worry about buffet style service and also service by employees at a wedding, because being at the event is really the factor that could lead to illnesses, not the food itself, but how we get food to people can be a facilitating factor. One thing here that I haven't mentioned, but I do want to highlight, is the term that we use here is PPE. It stands for personal protective equipment. This is where we would see things like cloth face coverings or other masks, and really highlighting what I would say is the necessity for that in protecting not only your employees but your patrons. It's a barrier, a hurdle that we are putting in place to stop moisture transfer from conversation, from breathing. In a sense, I had a question recently about agritourism business that was doing goat yoga, and thinking about certain situations where individuals are breathing harder because of what they're doing in the agritourism setting, and really my suggestion is requiring those individuals to wear cloth face masks as a way to block the moisture particles, that are moisture droplets that are coming out while they're breathing. But again, it's not a food safety concern that we're really focused on. So here are some best practices in general, and then I'll open this up to the questions in a couple of minutes. Should really take the health of their staff and guests seriously. I know that there are differences in community spread between some rural communities in North Carolina and elsewhere versus urban spread, but we do know that events and places where people congregate are places that we see clusters. You may not know somebody who is sick with this, but surely don't want your business to be the start of a cluster, or your event to be a start of the cluster in your community. So I would say that the types of businesses that I want to go to as someone who's focused on this is someone who's taking this seriously, someone who is putting best practices in place. I've already mentioned about health screenings. I'll introduce a different term here on cohorting. So one of the things that are very early on in the pandemic that we experienced in the restaurant industry was a full service restaurant who still was open, but thinking about their employees in different groups, saying this shift of employees will always work together. Because if one of these individuals gets sick from something that they're doing outside of the time that they're working for me, and everyone has to go into self-isolation for 14 days, if I can't get a test for them, then I don't want to lose my entire workforce. I want to have my shifts of individuals that only work with each other. That it's a terrible situation to be under from a labor standpoint, but at least I'm not losing my entire workforce. So cohorting or thinking about your employees not intermingling with each other would be the best practice. Creating plans for limiting volume and allowing for physical distancing. I talked a little bit about that already. One of the things that is really to our benefit in agritourism is that we're in a situation where we have the outsides to our advantage. So really planning for that physical distancing and limiting volume in certain areas. It's not as easy in retail market settings, and we'll talk a little bit about that in a second. But we've already talked about cleaning and disinfecting high-touch surfaces and face coverings and other personal protective. I really want to re-highlight this, that we do have very good data. The Center for Disease Control about 5 weeks ago now, 6 weeks ago, started recommending cloth face coverings and masks because it can reduce the risk of the wearer transmitting a virus. WHO has recently also echoed this. And it's a very good tool in areas where social distancing cannot be maintained. So I would say that employees as well as patrons in that area where we can't have social distancing, that they are wearing personal protective equipment to protect others. Gloves may not be necessary, but absolutely can increase the customer's sense of security. And I say it may not be necessary because gloves, hands can be a vehicle to transmit the virus. Hand washing and hand sanitizing can reduce risk. Glove use can reduce risk, but dirty gloves are just as bad as dirty hands. So I have to have some level of procedure and training for my staff, whether they're using gloves or not. But we would suggest, from what we've seen and worked with on the customer side of things over the last 13 weeks, that customers are very much looking for staff to be wearing personal protective equipment, gloves being one of those. Communication is really important. One of the things that I guess common questions that we received from you and from others who have been part of previous webinars is, well, what do I do if I have all these great standard operating procedures? What do I do? How do I communicate this to my patrons? To my customers? And I really would suggest that you go on the offensive communication side of things. Talk about what you are doing for public health protection of your customers, signage, social media, newsletters, whatever way that you can do to really encourage, here are the steps that we are taking. I would talk through for you what you expect them as a customer to do as well, that screen themselves for COVID-19 symptoms, exclude themselves from coming to your event, because we don't want individuals who are displaying symptoms to be there. If they've been in contact with someone who is positive, for also practicing what CDC is suggesting for self-isolation and monitoring for symptoms, using cloth face coverings, providing hand washing and hand sanitizer use for all people who are on the property who are partaking in any agritourism, and then really talking through what expectations are for physical distancing. And the very hard part about this is, and again, this is something that I have a lot of experience in when it comes to food safety in food preparation, is when you see somebody who's not following the standard operating procedures, really pointing that out and talking about why it's important that these procedures are in place. And that can lead to some customers not being happy about things. But on the flip side of that, I know from what we've seen in our surveys of customers and patrons going back to restaurants, that there are just as many people on the other side of this, that if they don't see someone getting called out for not following the rules, that they're going to turn around and walk out of your agritourism business as well, because they are there with the expectation that people are following the rules. So this enforcement of new policies is really, really important. Best practices for you pick farms. We did get a question about this. Really postponing large events or gatherings. We know that right now in phase 2 in North Carolina, under our executive order, the largest gathering in an outdoor facility is 25 people. So not housing more than 25. That number of 25 isn't magic. It's not that 26 now is all that much riskier. It's just a benchmark for us, but we do need to follow the executive order. Talked about cloth face coverings a lot. Really thinking about limiting the number of people at your farm at one time. When picking, we got a really great question from a muscadine grape producer, who said, I think that I think the number was 44 rows of grapes that I have, I could manage physical distancing of individuals who want to come here. That's that is the perfect type of approach. I do think that someone who's got 1 or 2 rows of U-Pick are in a different situation than someone who has 44. I think we have to look at how I can manage having people apart at least 6 feet, how I can manage with personal protective equipment, this idea, and really looking at this on a case-by-case basis. And being able to this means increased staff. This means saying up front, here's the rules of engagement of how you're going to be on my farm now, with ground markers, and then really enforcing that. Event centers are really a tough one right now. We got a question about weddings. What do I do? Well, following the executive orders is really important right now. I also think that, going back, and we'll talk about the Count on Me NCU program here in a second, but going through best practices for restaurants in dining areas would really be my suggestion. Looking at social and physical distancing of at least 6 people between folks, rethinking how I'm serving, cleaning and sanitizing, and employing and really screening my employees for their for symptoms are really the things that I would look at. The best practices that are set out by DHHS are something to really focus on. Candidly, as someone who's been in this world now for 13 weeks looking at best practices, I think weddings that we would have had in 2019 are not common practice now for probably a couple of years. I think we really have to look at how we are going to manage these events. We know CDC actually has they don't have any guidance specific to weddings, but they do have a bunch of guidance specific to funerals as a gathering, as a social gathering for families. And the reason why we have those specific guidance, those guidance talk about social and physical distancing, really looking at being able to encourage people to do things virtually as much as possible, and really limiting the amount of time that people are around each other, because we have numerous cases of clusters of people going to these events, to funerals specifically, hugging and being around their family members, that not only have led to clusters, but have led to numerous deaths linked to COVID-19. So I think in our world, we really have a focus around these events. So yes, absolutely following the executive orders, but I think it means more about being practical and really looking at how will you manage individuals who who are really looking for social distancing and giving them an opportunity to do so, but also encourage those who are not maybe following the rules to follow that around to protect patrons of that event as well as your employees and staff. One thing that I saw that that I think is going to become more commonplace is a way for individuals who don't want to be close to others to sort of signify themselves, whether that's with a bracelet or a sticker or something that they wear that says, you know what, I'm here, but I'm not going to hug you. I'm not going to be part of this, this close proximity because I'm in a high risk group. So being able to provide steps and think through that for your customers is something that I would encourage as well. On sales and farm stands, how is this going to change what we do? I think it's really too early to understand how this is going to impact retail sales around food in the long term. I think it really comes down to that biggest risk is being around other people, and looking at grocery stores as an example where there are steps in place to make sure that there's a flow of people going around from start to finish through the shopping process, that there are markers on the floor, that they're encouraging, and in some cases requiring face coverings for patrons that are going to be there, and then providing all the tools for hand washing and sanitizing. So the last thing I want to do is put a plug in for the Count on Me NC program. And again, this is something that may have been talked about yesterday, and I know that Annie really wanted to connect with us on this. It's a program that we developed the technical aspect of this at NC State through NC State Extension. My group, the Safe Plates program, did this. It's a partnership between the Restaurant and Lodging Association, Visit NC, as well as the Department of Health and Human Services. And it's a series of courses that you can take that are free, that are online. They're all at countonmenc.org, that go through best practices on all the things that I talked about. In the general aspect, there are 3 courses that are specific to restaurants, one from a restaurant operator, one from a front of the house or service staff, and one from the back of the house or kitchen staff perspective. And then there are 2 other classes, one that's generic best practices for businesses that might be a good starting point for you in agritourism, but also a 5th course that is specific to cleaning, disinfecting, and sanitizing facilities. And the goal of these programs is to provide the best practice for you to protect employees and guests, but also for you to share with your customers about what you are doing. And so these courses lead to a certificate that you can put your name on, that you can post at your place of business, that creates a community of individuals that are going through this. And as of right now, I don't have the absolute numbers that are in front of me. I forgot to check this morning, but we're up over 8,000 certificates that have been generated through taking these courses online. So again, here are the 5 classes that are available. And with that, I'm happy to end my screen sharing if I can figure out how to do that, and then take any questions that you might have. All right. I think we're ready. Annie, if there are questions or maybe you could help facilitate Victoria, the questions for me.
So, Victoria and Matt, do you have additional questions that may be different from the ones that have been covered? Or if you have a question that's popped up in your mind as you've been listening to Ben, just go ahead and type it in the chat and share, and we'll talk through it.
Hey, Ben, thanks so much for going through all of that information. I hope that was helpful to a lot of y'all. This is Matt speaking, by the way. One question that we had gotten was, what do we as businesses need to implement for contact tracing? I feel like I've heard of some places like churches going to like sign-in sheets and stuff like that, but what have you seen from the business side?
Yeah, thanks, Matt. This is a great question. So this is one where it's really important to connect with your local health department on this, because there isn't sort of a statewide or a national sort of way to do contact tracing. And what Matt's talking about is, what do I do if someone says to me, I was sick and I was at your event or I was at your business? What's the how do I inform people, and what do I do to really recontact other individuals? The best, this is one where I think there's a lot of variability from a best practice standpoint. If it's an event like a wedding, a meeting, a conference, and again, we're not in that situation now, but let's go forward 6 months, and we'll still be in the midst of managing COVID-19. I think having sign-in sheets and really communicating with people that are at those events that we will use this information to with organizers to connect with you if there's been some exposure. That's sort of best practice. When it comes to retail settings, restaurants, we really have not seen the contact tracing be the responsibility of that individual business. And I guess what I would suggest is this is a good place to connect with that local health department. I'm not aware of any local health departments in North Carolina or elsewhere that are requiring any sort of contact tracing steps for patrons of a market or of a restaurant. But definitely there are places that are requiring that for gatherings that are in that 25 person range to recontact individuals elsewhere outside. One thing that it really depends on the timing and the individual and whether the person is symptomatic or not on the spread of illness. And so there was some confusing stuff that came out, I guess it was earlier this week or late last week, about asymptomatic people not being really a factor in spreading the illness. And it's not exactly what the studies said. It's that people that never develop the symptoms are not as likely to spread the virus, but people that do not have symptoms but are pre-symptomatic, meaning that at some point they develop symptoms, are still a big factor in spread. In fact, many of them that we've seen in previous clusters are called super spreaders. So that all being said, I think that contact tracing is really something important in these events where people are spending a lot of time around each other and there's not physical distancing or other ways to separate individuals, but it's not as important in a market setting or a restaurant. And in fact, if you think about grocery stores that have been operational over the last 12 weeks, we don't have any examples of someone who shopped at a specific grocery store who was positive, then that grocery store then going back out to all of their patrons saying, hey, there's been someone who shopped here that you should think about. Or that you should be aware of. So Matt, I hope that answers the question. I think it's the bigger the event and the more the less physical distancing there is, and the more likelihood that people are spending more time around each other, contact tracing is going to become very important. And working with the local health department on their expectations would be the best place to go. And sorry, someone's delivering something in my house, so my dog is barking in the background. So one of the benefits of everyone working at home now, I guess.
Awesome. Thanks, Ben. That was a really great answer, very informative. Again, if you have any more questions, feel free to drop them in the chat and we'll get to them here in a bit. One thing that a lot of people had asked about was enforcement. And I think you touched on that a little bit earlier. But a lot of people were concerned about how to do this diplomatically, how to tell people that that see the signs and aren't using the sanitizing stations or aren't wearing a face mask or something. Like, how do you have those conversations? Do you have to kick these people out? Just wondering what you might have seen from other businesses or other people that you've talked to, how they've gone about that conversation.
Yeah, so this is something that actually my group does a lot of research in. It's behaviors around public health and food safety, specifically, and enforcement of best practices is something that we struggle with kind of all the time. So one thing that I would suggest is the biggest way that we know from the literature on why people behave the way they are, that if we want them to make a change, is explaining to them not just what the change is that we want them to make, but the why behind it. And this one has a very specific why to me. And it is, I'm asking you to do this not only for the health and safety of other patrons, but it's for the health and safety of my employees. These are individuals. I'm allowing you into my business, into my agritourism setting, and I don't want you to bring in a virus that you may not be aware that you're bringing in and make my staff sick, and then resulting in me having to shut down or be a cluster for illnesses. And so having a really frank conversation with that individual, and then also highlighting, here are the whys that I'm doing this, and then we have other ways for you to participate in whatever event that we're doing here, if that's an option. And I think back to an anecdote of one of the first times I went to a grocery store back in March after the pandemic was announced and we went into our state lockdown here in North Carolina. I was at the self-serve cashier at the grocery store that's really close to me, and an individual walked in who was coughing, and whether that individual was sick with COVID-19 or not, no one knows. But this individual was displaying symptoms, and really like loudly, like overtly. And a manager or someone who was in charge went over and sort of said, and in earshot of everyone else, we have other ways. We can't have you here right now. We can't have you here because it's not safe for our employees and it's not safe for our patrons. And we have other ways for you to get groceries. We have curbside pickup and we have delivery. So can I urge you to go to this other area where we can get you what you need? And the person, there wasn't like an altercation. The person kind of shrugged and left. But I thought it was a really good, tactful way of getting that information to the individual. And it is like, please don't get me wrong, that is an awkward conversation. These are tough things to do. Telling someone that they're not following your rules is tough. I do it. I'm the father of a 9 and 11-year-old kid, 9 and 11-year-old kids. I do it every day as a parent, and it's hard. These are hard conversations. And I do think that we need to make sure that we're prepared and we're equipping our staff and empowering them to have those hard conversations. But there's no, Matt, to your question, there's no easy way to do this. There's no best practice that's going to make someone who is feeling awkward about having that conversation with a patron feel a lot better, other than sort of saying, here's why we're doing it, and really standing firm on these are the rules that we have. And I want to highlight something that I mentioned before. The flip side of that is there's some other patron in your agritourism business that sees this person who's not following the rules, and they are following the rules. And if they don't see some level of enforcement, that might be the last time that they visit your business, because they're happy, or they're here because of the way that you're managing things, and that enforcement is all part of it. So I think it is, like I said, this is a tough set of conversations to have. There's a lot of polarization of this issue. There's a lot of politics wrapped up in COVID-19. I come at this from a public health perspective, and I think it's important that we continue to have these conversations, but we really also need to say, here are the rules that I'm going to follow, and I'm going to enforce them. And if you can't be part of this world, then I'm going to fire you as my customer, which is hard to do. But I think it's important in the sense of I'm protecting other customers and my employees.
Thanks, Ben. I think that's a really helpful answer. We're just thinking about emphasizing the why to our customers, just explaining why it's important. We're protecting our employees, we're protecting our business, we're protecting everyone around here. So just stick to your principles on that, stick to the practices that you're implementing, because that could be a positive for your business as well. The last question that I have on here, we had someone asking, do farms considered ag exempt have to follow the same rules as a restaurant or venue for food safety guidelines?
Right, and it's a great question, and it's not something that's very specific to COVID-19. So it really depends on what your business is doing, and I would look again to your local health department specifically to understand if you're ag exempt for certain aspects of your business, but you still are permitted, like a permitted facility where you got an inspection grade, then absolutely you need to follow the food safety rules because that comes with that permit. If you're ag exempt as a retail setting, there are other public health things that you may need to follow. But from a food safety standpoint, you follow that you can follow that exemption. When I hear a question like that, it concerns me though, because what I really want someone to do is not say, what is it that I'm exempt from? It's what are the best practices that I should be doing from a food safety standpoint? What types of things do I need to put into place to protect? And again, let me step out of COVID-19 specifically, but what do I need to do to protect food safety? What kind of cleaning and sanitizing do I need to do? What kind of hand washing do I need to put in place? How do I screen my employees for things like norovirus and hepatitis A and other things? What are my employee health responsibilities? I want to visit an agritourism business that isn't seeking the exemption as a loophole to supplant the rules, but I want to go, they may have that exemption for enforcement, but I want them to also be following the best practices that are out there. And I say that because I know that many agritourism businesses that I've been a patron and a customer of over the last 15 years, and that I've worked with in this area are doing those things. And so I want them to promote that they're doing and following these best practices, but looking at exactly what rules they need to follow from a regulatory enforcement standpoint really becomes a question for their local health department on how they're going to address that. But it's kind of like a trite statement that I will put out there over and over again. I really want to make sure that we're doing best practices, not because it's a regulatory requirement, but it's because it's the best thing to do to protect my business and to protect food safety. And I work in this world 24/7, and I've seen many agritourism businesses be destroyed, and many restaurant businesses, and many farm businesses, and many processing businesses be destroyed because of not following best practices, not because they were unregulated or not regulated, but because they weren't doing the right things when it came to food safety. And the illnesses that they were responsible for destroy the business. And so to me, that the question, the way it's phrased, becomes a problem for me. I really want to be like, what are it's not what am I exempt from? It's like, what should I be doing? How should I get better at food safety? How should I be getting better at COVID-19 risk reduction to protect my business?
Awesome. Thanks, Ben. So I think we're getting at just let safety be your guiding principle, and then the rules can follow from that, and talk to your local health department about finding what those rules might be and what those best practices are. That's about all that I have. So I'll pass it to Victoria or Annie if you have anything else to say, and we can wrap up. Thanks, Ben.
Thanks, Matt.
Yeah, I don't see any more
Thank you, Matt.
either. So Annie can go ahead.
Thank you, Victoria and Matt. Great job navigating those questions, Matt and Ben. We really appreciate it. And, Ben, you did a great job of unpacking this and what it means to agribusinesses, be them destinations, restaurants, whoever's on this webinar today that's supporting places where people congregate or, pick up food or visit a farm stand, whatever it is. I really like the fact that you underscored this is about protecting your business and your community. And it's taking the proactive steps. These are actions that are not difficult to take. It's just different. And like Ben said in the very opening, that this is going to be around for a while. And it's important. We value your contribution to the agriculture industry, and we want you to be here, a year from now, 2 years from now, whenever it is that, we either learn to live with COVID or things adjust. So we really appreciate you tuning in to this webinar today. Please go to countonme.org and take the pledge, take the courses that make sense for your agribusiness. They're short, they're very precise, they give good guidance. And again, this is a way where all of us can come together, where it's a dual pledge between consumers and businesses in support of strong, safe health and safety measures that we can all take. So is there any last comment that you might have, Ben, for this group?
I guess, yeah, just to reinforce one of the things that I said earlier is that what, and I really like the way you said it, Annie, it's like, it's not, these things aren't hard, but we do need to think differently about it. And the thing I want you to think differently about it is, how do we continue to have a thriving business where we're limiting people being around other people? Because that is the number one factor that we see in spreading this illness is person-to-person transmission. And we'll learn more over the next 18 months or 2 years about specific factors. And there's some really interesting things about like singing and cardiovascular or cardio exercise leading to more air movement through our lungs, leading to more transmission. We'll learn more and more about this, but at the very heart of this is, how do I and my business manage having people protect themselves from other people as much as possible? And that's the really stepping back and looking at my operation, looking at my business and thinking about that. It would be my parting words, and putting things in place to make sure that you're limiting that and then enforcing those rules that you're putting in place. But yeah, thanks again for inviting me to be part of this, and I'll echo your words, Annie, as well. I'm a big supporter of agribusinesses and agritourism. I think it's really important that we continue to support this sector and explicitly support on what it means going forward. And I'm here as a resource for all of you, and my group is, and our network of people right throughout the U.S. to help answer some of these questions. So I appreciate you giving me the time to talk about it, and please don't hesitate to reach out and continue to ask questions.
So Ben, as you were chatting about, learning more as we go here, people singing, all of that, the thought about indoor experiences versus outdoor experiences came to mind. So we have just a few minutes left. Would you please just share with us a little bit about that? Because that's particularly important now as restaurants start to open up and they've got outdoor seating available since we're in the warm months. Agritourism operations are outdoors, farmers markets are open air. So just speak to that point a little bit.
Yeah, absolutely. So what we know is that outdoor transmission seems to be much less than indoor transmission. And part of it is really the factor of indoors. I am constrained by walls. I can't really do much about physical distancing and social distancing. There are bottlenecks of how people get in and out through specific, entryways. Where an outdoor situation, I can spread things out. It allows for me to do much more for physical distancing. So there's nothing magic about being outdoors. It's just that there is more space for me to do a better job at managing things as an operator. And there are some other factors about outdoors that also appear to matter, like UV light has an effect on the virus itself. So being that we are exposed to UV light outdoors can certainly help. I don't think we know enough about what it is about outdoors yet, if there are other factors, but if I had a choice in my business to move things outdoors versus indoors, I would for sure move it outdoors because I have less constraints on the physical aspect of my business. But that's not an answer for everybody because it's not going to work in all settings. But yeah, I mean, that would be a first step. If I've had the ability to do it, I absolutely would do that.
That's great. Thank you so much. So are there any other questions that have come up? We've got 1 minute before we close. Otherwise, we can sign off. Okay. Well, thank you again, Ben, for joining us and for going through all of those details. Very, very helpful and informative. And thanks again to Matt and Victoria, who are on the Visit and See Farms app team that navigated the Q&A. You all are terrific. Keep going. Do reach out to us, to Ben and his team. We will help in any way that we can. Thank you all. And we wish you a good afternoon and take good care.
Thank you.